On this episode, I am joined by Greenway Health CEO Richard Atkin. Richard joined Greenway Health in late June and is making his first appearance on the podcast. Hear about his life before Greenway Health, what stands out in his first 3 months here, his vision for Greenway Health in the future as new initiatives are rolled out to foster growth and customer satisfaction, and life outside of Greenway Health. What does Richard enjoy when he's not at work? Meet Richard Atkin, the CEO of Greenway Health. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and thank you for tuning into this episode of Putting Possibility into Practice. And we welcome to the podcast, making his first appearance, CEO Richard Atkin. As I mentioned in the introduction, Richard has been with Greenway since late June. And Richard, welcome to the podcast for the first time.
Yeah, thank you, Joe. I'm excited to be here, and I appreciate this opportunity to talk to our customers.
And the first thing customers and our listeners are going to notice is the accent. So where is the accent from?
I hope they do recognize the accent, Joe. You know, I've been in the States now 24 years, but I grew up in the UK. I grew up in a beautiful city in the west of England called Bath, a very ancient city, a Roman city. But I've lived in a number of places, both in the UK and here in the US. I'm now proud to be a US citizen, but in my time in the US, I've lived in Wisconsin, in Massachusetts, in North Carolina, Tennessee, Texas, and now down in Florida in Tampa.
Very good. And you've been with us now for about 3 months. So did you just relocate down to the Tampa area?
Yeah, just about 3 months, and already have relocated. We found a place in St. Petersburg, about half an hour from the office here in Tampa.
Very nice. Well, welcome to Florida and welcome to Greenway. And let's talk about what brought you to Greenway Health.
Yeah, so I've been the CEO of a number of companies in the healthcare arena, medical technology companies and software companies, and been a CEO of a Vista portfolio company previously as well, and been on the board of Greenway for about a year. So I have a very deep experience in healthcare. And there was an opportunity to come join Greenway, and I really jumped at that. I really enjoy being a CEO. I like helping companies achieve their potential, and I like working with customers. And so it was really the opportunity in the background, it came together.
And you've been with us for just about 3 months, as I mentioned. So in your first, give or take, 90 days, what stands out the most meeting customers and the team members here at Greenway?
Yeah, it's been a busy 90 days. Just after I started, we had our Engage event. So that provided the opportunity for me to meet with about 1,600 customers and got a lot of good information about how we serve the customers, but also how we can improve how we serve the customers. But in addition to that, of course, the people here at Greenway, so things that stood out there are just the dedication. The dedication they have to healthcare, one, to the customer, but also to provide solutions that help our customers serve their customers, i.e. the patient. And so I think those are the high level things. As I sort of drilled down on that, I think this transition that's occurring, transformation even in the ambulatory healthcare space is a critical element that we can help with as a company. By that I mean the transition to value-based care, the transition to ensuring patients get the care that they need in a safe and effective manner, the way in which we can deliver healthcare more effectively. I think those are really some of the key things that really resonated with me in the first 90 days.
And in the constant changing industry that we're in of healthcare IT and in the healthcare industry in itself, what's your vision for Greenway moving forward in this ever-changing industry?
Yeah, so probably the things I've learned in the first 90 days might be clues to that sort of approach. So what can we do? How can we do that better as Greenway? But, I always start with the customer. I think an organization should be customer in. How do you serve the customer? How do you understand their world? The challenges that they have. So my vision is that Greenway should be known as the company in the ambulatory healthcare space that knows its customers better than any other organization. That we know the challenges, as I mentioned earlier, that we know how we can apply software and technology to help them address those challenges. And if we start with that view of really understanding the customer's world and being very close to that in terms of our knowledge and our capability, then a whole series of things flow. We can then create products that address those needs. We can create the services that enable the customers to utilize those products and get the real value from them. We can ensure that we help them get the reward for their work in terms of the revenues to get paid for the services that they provide. And we can ensure that the patients get safe, effective care. And so in there is my vision that Greenway becomes more effective at listening to the customer. It becomes more effective at creating the solutions that our customers need, and we become more effective at ensuring that our customers get paid for the work that they do.
And a couple of new initiatives announced recently to help foster growth, professional development, and continued customer service excellence. Talk a little bit about those initiatives that we had announced.
Yeah, so one of those is I've come in and again building off the theme of the things I've just said, is that I felt that we could have a greater focus on right first time, on delivering quality, as well as delivering the product itself. And so I've expanded our view of what quality and compliance means. My perspective is that quality is an ever-changing and ever-rising bar. And so what good quality looked like 5 years ago or 10 years ago is very different than what it looks like today. And so I felt there was an opportunity to really get focused on that. So we hired a head of regulatory and quality affairs, Patrice Nedelec. We're hiring a chief compliance officer, and we're getting in place the elements of a quality management system that I believe will enable us to become certified into standards like ISO, and really be able to improve the overall quality of our solutions, but also potentially raise the bar within the industry of what quality means.
Outside of work, is there a life outside of work for a CEO of a company? And if so, what do you enjoy doing?
Well, yeah, so there is. Of course, this keeps me very busy, sort of inside work, but I do take time to ensure that there's a balance. Whether that's truly balanced or not, others would have to judge. But my wife and I, we have a big family. We spend a lot of time with the family. In fact, it's a blended family. We have 10 children, so that keeps me very busy. Also, love music, live music. We go to a lot of concerts, but also, I'm a bit of a collector in that regard. So have hundreds and hundreds of CDs, but I also have a very large collection of vinyl. And in fact, I have every single vinyl record that I've ever purchased, going all the way back to one I purchased with my birthday money when I was 13. So this will now age me. I went to the store and I purchased Bob Dylan's Blonde on Blonde, which was freshly released, with my birthday money when I was 13, and I still have that very same album. In fact, I have every album that I've ever purchased.
And you keep the collection at home, or
yeah?
I mean, that's got to be a big collection.
It is, and I've sort of hauled it around from the UK to the US and all those other places I mentioned in between where we've lived. But it is a large collection. It currently resides at a property we own in North Carolina, in the mountains of North Carolina. and don't get there enough because of work at the moment, but that's where it all is, and just love going there and spending time.
Do you have a favorite musician, or what maybe perhaps is your favorite concert you've attended?
Yes, all of those. So my favorite musician sort of all time is Bob Dylan. I've got everything that he's ever recorded and some bootlegs too. My favorite track of all time is actually Bruce Springsteen, Born to Run. Been to a lot of concerts, some that were surprisingly good, in the sense that, you know, my wife's a big fan of the Eagles, and I said, okay, well, if you really want to go see them, we will. But that was a fabulous concert. They really put on a very, very good show. Probably my, but the favorite concert of all was back in a few years back. My wife and I were able to go see Leonard Cohen, and that's an acquired taste. But you know, he unfortunately passed away about 18 months ago. But that was a great concert. Just having the opportunity to go see Leonard Cohen.
And I want to thank Greenway Health CEO Richard Atkin. Thank you for taking time out of your busy day and joining us for the first time here on Putting Possibility into Practice.
Thank you, Joe. I really enjoyed it, and I look forward to the opportunity to talk to you again as we develop our strategy here.
And we will definitely have him as a frequent guest here on our podcast. And I thank you for listening to this episode of Putting Possibility into Practice, the podcast from Greenway Health. I'm Joe Augustinelli, Social Media Manager, and for more information on Greenway Health, you can visit our website at www.greenwayhealth.com.